So, we have many Indians who are crazy about coffee and tea. The first thing I advise them surgery, they are more bothered, doctor, when can I have my first coffee before the surgery and when can I have my first tea after the surgery. They are more concerned about their tea and coffee than the surgery process, pain and all that. Now, coming to these people, if you're looking for tea and coffee, when can you have? Now, in case you're getting admitted for a surgery in a hospital under proper anesthesia, general, spinal, you need to have a fasting level of at least 6 hours. That means 6 hours before the surgery, you should be fasting, and 6 hours after the surgery, you should also be fasting. Now, normally coffee and tea are considered to cause little bit of acidity. So, when you take it on an empty stomach, it increases the amount of acid in your stomach. So, what happens is, we generally try to avoid coffee and tea because it sometimes increases acidity. Already you are stressed because you are undergoing a procedure. The stress itself increases the acidity. On top of that, you are taking a coffee or tea, this will tend to worsen. So, we preferably advise them not to have any coffee, tea on an empty stomach. In case you are very particular that I have to have my coffee or tea, probably you can take a couple of biscuits or let's say a bread and dip it in that and have just to get the taste of it. Again, this should be 6 hours before surgery and 6 hours after surgery. Let us say you undergo an intestinal surgery, you will be off of fluids and even water for a couple of, sometimes if it's a complicated surgery, it will be couple of days. If it's a simpler surgery, maybe 6 to 8 hours. So, it again depends on the type of surgery. But if you are getting a non-intestinal surgery, let us say a breast lump or a thyroid lump, or you are undergoing some procedure in your leg, normally after 6 hours of post procedure, you can undergo or you can take your fluids, initially water, and once you are comfortable, you can start taking coffee. But most of my patients, I advise coffee and tea with some meal. Example, let's say they've taken the breakfast, overnight surgery is undergone, they're taking the breakfast. I ask them not to take it empty stomach, have a little bit of, let's say, some sort of idli, poha, pongal, something like that. Then you take a cup of coffee. Empty stomach, try and avoid. And post surgery, can we continue taking coffee and tea? Sometimes if it's a simple surgery, couple of painkillers, antibiotics and acidity medicines there. So, when you're taking so many mixture of medications, your stomach is already a little sore. On top of that, taking coffee tea may not be a wise decision. In case you are must and should, a small quantity can be taken after having a proper meal. So, these are some information for all you tea and coffee lovers. Hopefully, this was useful, and always check with your doctor when can you have it. Based on the type of surgery, they will suggest what can be done. Thank you.